Okay, so onto obsessive compulsive disorder, also called OCD. Obsessive compulsive disorder is again one of the anxiety disorders. It involves obsessions, which are repetitive, obsessive, intrusive thoughts, and compulsions, urges to engage in behavior or counting or checking or cleaning that are overwhelming and feel absolutely necessary. The person may have some false beliefs that if they don't do this, something bad will happen. They are similar to some of the false beliefs that we'll discuss later on in schizophrenia and the schizophrenic type disorders. However, individuals with anxiety disorders know for a fact that the beliefs that they have are not rational. However, they cannot stop doing the behavior, stop having the compulsions and the obsessions that they have, even though they know they're not realistic. Whereas someone with schizophrenia who has abnormal beliefs or unrealistic beliefs believes that these beliefs are fact. So that's a key way where these compulsions and these beliefs and thoughts are different from some of the beliefs and thoughts that individuals with the schizophrenic type disorders have. So there seems to be a relatively equal uh, disbursement of OCD between men and women and racial and ethnic groups. Um, Only about 40% seek treatment. However, treatment is available. Treatment can be very beneficial, and there are several treatments available. Typically, obsessive compulsive disorder is first observed in childhood or young adulthood, more frequently in adulthood, but have been observations. There are children who suffer from obsessive compulsive disorder, and like many other psychological disorders, it typically will worsen without treatment. So early intervention is very key. So, obsessive compulsive disorder, these repeated obsessions or compulsions or desires to do or urges to do these behaviors, the obsessions or compulsions take up a significant amount of time. Individuals can take 2 or 3 hours a day, or sometimes even all day, just to get ready in the morning, to shower, to count things as they go. It can cause very significant distress or impairment in their day to day life and significantly affect their ability to function. And I have linked on Blackboard several videos with individuals discussing their experience with anxiety disorders and particularly obsessive compulsive disorder. So, some of the common themes of the obsessions, the repeated thoughts. Individuals can focus on dirt or contamination or germs, um, fears or concerns about violence or aggression. Sometimes individuals will have compulsions to be aggressive or to commit violence, or have repeated thoughts about violence. Um, Obsessions surrounding orderliness or organization, sometimes around religion or sexuality, are some of the common themes of these obsessive thoughts. Again, these compulsions, these urges to perform a behavior or a ritual, feel very overwhelming. They feel mandatory, like they can't stop doing the behavior. The behaviors are unreasonable. Okay, so these compulsions can feel, again, mandatory. The individual feels like they can't stop them. Doing the behavior reduces anxiety for a short time, and that's believed to be what reinforces the behavior. So the more the anxiety is reduced, that serves as a reward, and the individual will continue to do that behavior because it reduces the anxiety, if even only for a short time. Again, some of the themes can be involved with cleaning or checking or counting, putting things in order, sometimes touching things and counting them, sometimes doing it out loud. So again, all of these can also be very disruptive to an individual's everyday life. The cognitive behavioral perspective, again, helps the individual re-examine their beliefs and their behaviors and tries to challenge those beliefs and reduce the behaviors and increase more positive behaviors. One of the most common types of behavioral therapy is this ERP, exposure and response prevention therapy. And here's, if you click on this link here, there's a video example of a client and a therapist engaging in this ERP therapy. You'll see the therapist set an example for the client. This could be used with video conferencing, and again, especially now with the COVID crisis, that may be an option for some. Individuals can experience up to a 70% improvement with therapy, which is significant. So again, therapy is available, treatments are available, and can be very effective. Antidepressants are also sometimes used with obsessive compulsive disorder and seem to be very effective. Like many other disorders, the combination of medication and cognitive behavioral therapy is sort of considered the gold standard because it tends to work very well and also have long-term benefit, particularly that cognitive behavioral therapy aspect. There are a few other related obsessive compulsive type disorders in the DSM. Hoarding disorder, which has gotten a lot of media attention lately with television shows like the show Hoarders. It is a significantly disruptive disorder. There are treatments available. Unfortunately, just cleaning out the individual's home and getting rid of all their stuff is not an effective treatment. The individual really needs to work through why they saved all of those things and what their thought process behind it was. So that cognitive behavioral therapy of challenging those beliefs and changing their behavior. Some other common obsessive compulsive type disorders, trichotillomania, which can be difficult to say, is a hair pulling disorder where individuals will pull large chunks of hair from their head, typically, sometimes other parts of their body, but most frequently their head. They can sometimes have a large patch of hair missing from this. Excoriation or skin picking disorder. Individuals can cause significant scarring or damage to their skin. And body dysmorphic disorder, which is a significant misperception, belief that parts of their body or all of their body are significantly distorted and abnormal. And again, there are treatments available for all of these disorders.